During COVID, many of us have gained weight, and during this time, the popularity of many weight loss injections surged. Many of us and our friends were prescribed these medications on or off label, such as Ozempic, Mounjaro, Wegovy, and more recently Zepbound, and are wondering how long will they need to be on these medications, what will happen when they stop. This video is going to discuss what are the possibilities once these medications are stopped. So there are patients who are currently using Ozempic and Mounjaro to treat their diabetes, and those patients need to discuss cessation of medication with their physicians as they are needed for their diabetes in many cases. But when used as weight loss purpose medications, the question becomes, do we use these forever, or how can we stop? What will happen? Will I regain the weight? Patients respond differently depending on their biology. So there are many patients who now have used the time while on the medications to change their eating habits, start exercising. Those patients will have a higher chance of remaining off the medication. Their medications are a great tool to get one jump started and make it easier to withstand cravings and reach a healthier weight. In my practice, I have numerous patients who did not need to be on the medication long term for various reasons, costs, coverage by insurance. They had to stop, and we have maintained their weight that they have lost. So not necessarily do they gain it back. There are, however, patients who have suffered with obesity for the majority of their lives. Those patients will have a harder time to keep off the weight than patients who had a recent postmenopausal weight gain or weight gain during COVID. Patients often have very strong genetics, either one or two parents who are obese, and then themselves obese will be a much higher risk to regain all of their weight or most of their weight after stopping the weight loss medications such as Ozempic, Mounjaro, Zepbound, and Wegovy, where the latter two are used on label for obesity. There are some patients who will regain some of the weight back, but not the entire weight, depending again on the habits that they have succeeded to maintain while on the medication. So just like any treatment, it has to be multimodality. Medication alone in most patients will not do the job. And, just a quick fix, maybe, get a few pounds off, but we don't know what happens in the future. And especially when one stops this medication, it will regain in that case. If you'd like to learn more, please visit our website at www.drrotamamir.com.